The next 8 minutes might change your view forever. We've all experienced this feeling once. Everything seems to be fine, but as hours pass, symptoms get worse, and the following week your relapses are gone. Quite confusing, isn't it? But chronic diseases like multiple sclerosis can impact your life and daily routine as symptoms progress over time. Waiting for something that you can't predict is frustrating, as it can impair your future plans and goals. For this reason, let's talk about the signs and symptoms of multiple sclerosis that you must watch out for. Multiple sclerosis is an autoimmune disease that affects the central nervous system, which consists of the brain and spinal cord. Your immune system's primary function is to protect you from viruses and bacteria, but in the presence of autoimmune disorders, it mistakenly attacks the organs or tissues in your body. Multiple sclerosis is characterized by the immune system attacking myelin, or the protective sheath around the nerves, that speeds up the transmission of impulses from the brain to the spinal cord and other parts of the body. The damage to the myelin sheath is called demyelination, and it slows down the functions of the nerves that connect the brain to the rest of the body, including optic nerves or spinal cord. Here are 10 common symptoms of multiple sclerosis that you should never ignore. Number 1, optic neuritis. The optic nerve is found at the back of your eye, and it sends the impulses to your brain. It delivers the details of the objects you see, which the brain needs to interpret. When demyelination happens near the optic nerve, it will affect your vision. Some of the symptoms of MS caused by damage to your optic nerve are diplopia, nystagmus, and optic neuritis. Optic neuritis develops when the optic nerve gets inflamed during demyelination. Symptoms that accompany optic neuritis are blurry or loss of vision, difficulty in distinguishing colors, pain in the eyes. People with multiple sclerosis tend to see dull instead of bright colors, and they may see a dark spot on objects. Number 2, diplopia. Diplopia, also called double vision, is characterized by seeing two images of the same object. When you focus on something, like a tree, it will appear like two trees are overlapping with each other, in which the other one is made of broken lines or images. Number 3, nystagmus. Nystagmus, also known as dancing eyes, is the vibration or involuntary movements of the eyes. It can go from side to side, circular, or up and down motions depending on the condition of the MS patient. Number 4, Lermet's sign. Lermet's sign, or Lermet's phenomenon, is a symptom associated with demyelination in the spinal cord. MS patients might feel an electric shock-like feeling when they bend their necks downwards. It is a sudden tingling and buzzing feeling that goes down the spine, arms, legs, and fingers. Lermet's sign is also called the barber chair phenomenon because the sensation comes from bending your neck and lowering your chin, which is similar to the position in which a barber cuts your hair. Number 5, spasticity. Muscle tightness is a symptom that occurs when plaques damage your motor pathways. Spasticity is characterized by the prolonged contraction of your muscles, which causes spasms in your arms and legs. There are two types of spasticity, flexor and extensor spasticity. Flexor spasticity happens when your muscles become so stiff that you're unable to straighten them when it's bent. On the other hand, extensor spasticity occurs when straightened muscles become too tight that they cannot be bent. How many of these symptoms have you experienced already? Or do you know someone who does? Share with us in the comments below so we can have a fruitful discussion about this alarming disease. Don't forget to subscribe to our channel for more health and wellness tips. Number 6, ataxia. Staggering gait and unsteady movements are common signs of ataxia. Ataxia is caused by demyelination in the cerebellum, or the part of the brain that controls muscle coordination. The damage in the cerebellum affects the voluntary and involuntary movements of MS patients, such as walking, eating, and swallowing. Other symptoms associated with ataxia are loss of balance, slow eye movements, and slurred speech. If you feel like you're constantly experiencing these drunk-like symptoms, or you know someone who does, consider consulting a doctor for early diagnosis. Number 7, paresthesia. Multiple sclerosis can cause a burning and prickling sensation in your hands, arms, and legs. This symptom is called paresthesia, which is usually painless but may cause numbness and a pins and needles feeling. Paresthesia is a simple and common sensation that can happen when you cross your legs for too long or sleep with your arm pinned under your head. It may be overlooked, but it can manifest as a more serious sign of multiple sclerosis. Try seeing your doctor if paresthesia occurs persistently for a week or more. Number 8, overactive bladder and sexual dysfunction. Frequent calls of nature may also be a sign of multiple sclerosis, when plaques accumulate in your autonomous nervous system. This region in your brain controls your bowel and urination. Once it is demyelinated, it may cause MS patients to experience diarrhea, constipation, and loss of bowel control. Strong urges to urinate and being unable to control your urine are also signs that you should look out for. Another symptom caused by the damage to the autonomous nervous system is sexual dysfunction. Experts say that people with MS tend to experience vaginal dryness, lower sex drive, have difficulty in achieving orgasm or maintaining an erection. The worst thing that could happen is it may lead to impotence in men if MS symptoms are left mismanaged. Number 9. Loss of concentration. Not only does multiple sclerosis impair the vision and movement of its victims, but it also affects brain function, like cognition and emotions. People with MS often tend to have difficulty paying attention and loss of concentration. Since demyelination slows down the transmission of impulses, cognitive function also weakens as the MS symptoms progress. It can lead to memory and decision-making problems for the patient. In one study, a male patient named Felix, who was interviewed by Roche Biotech Company, attested that living with multiple sclerosis had been hard, to the point that he quit reading books after he was diagnosed. He said he could not remember anything from the material that he was reading due to the manifestation of his MS symptoms. Have you lost concentration while watching these facts? Perhaps clicking a like and subscribe button might help improve it a little. Number 10. Depression. Another symptom that an MS patient could feel is depression. Due to the diminished functions of the brain, people with MS may experience mood swings, anxiety, and depression. According to a review published in the Journal of Neurology, Neurosurgery, and Neuropathy, there is a 50% lifetime prevalence rate of depression amongst MS patients. Studies also show that besides the abnormal function in their central nervous system, MS patients are more prone to depression than the average person because of their limited access to a lifestyle that a healthy person can have. In addition, take note that depression may be linked to other health problems, like chronic fatigue syndrome, which we talked about in one of our previous videos. It is important that you don't conduct a self-diagnosis, and you must consult a specialist in multiple sclerosis to guide you further. Multiple sclerosis is more common among women than men, ages 20 to 40 years old. The root cause of the disease is still unknown, and it also has no cure. However, genetic factors like gender and environmental factors such as infections and vitamin D deficiency may contribute to the occurrence of multiple sclerosis. How did you find this video? Tell us how you feel about it, or hit the like button if you find it useful. Share this with your friends as well so we can all battle multiple sclerosis. Stay with Natural Education to find out more about chronic fatigue syndrome and how it may be linked to the symptoms of multiple sclerosis.